Okay. All right. Good afternoon, everyone. I apologize for all the crazy. My name is Susie Seitz, and I am the Waiver Support Coordinator Liaison for State Office. Today, we are here with Karen Hagan, APD's Emergency Coordination Officer, who has put together a presentation for you on disaster planning and preparation. We will go over what should be done in the event of an emergency or natural disaster, including preparedness, response, recovery, and mitigation, along with information about the local, state, and federal response and resources that become available. The role of the WSC throughout the disaster cycle will be outlined along with that of APD. If you have any questions, please feel free to use the questions box and we will get to them at the end of the presentation. This presentation will be recorded and will be posted on the APD's YouTube channel soon. Now, I'll pass it over to Karen.
Thank you, Susie, and thank you, everybody. Thank you for your patience. We'll get on with this. I'm so happy to be joining you today, and I want to thank all of the folks who are taking the time this Friday afternoon to join us. You know, I'm going to have Susie switch the slides, but not quite yet. I do want to say that every state agencies in Florida has an emergency coordinating officer, and that's the hat that I have the privilege to wear. And I think that it's important to know that we're all standing behind you at all times. And if no one has thanked you for the work that you do every single day, let me take the opportunity to thank you. At least if they haven't thanked you today, I really appreciate the work that you do. You can switch the slide, Susie. This first slide, and what I'm going to talk about, disasters in Florida, how it affects us individually, how it affects the work that we do. Because, you know, if you think about disasters, not just hurricanes. I mean, in Florida, we think about hurricanes all the time, but in Florida, we've been affected by winter storms, tornadoes, floods, pandemics, wildfires, plane crashes, straight line winds, and more. And of course, hurricanes. But if there's anything that levels the playing field, it's a large-scale emergency, such as a public health emergency or a major disaster. I'm sure everyone on this call has been affected by one of those disasters that I just listed, and especially in the last couple of years. But we've gotten through it. You know, we're all survivors in one way, shape, or form. And I do want to just say, you know, we're in this together. It affects everybody. You know, worldwide, actually, nationwide, statewide. So we are here, and we are here together, and no one, not you, not your families, not the people that you care about or you care for, should fall through the cracks in a state as prepared and rich as we are in the emergency management world. Next slide. So this, as you're looking at it, this is the emergency management cycle. It's not just the APD's emergency management cycle, it's the nationwide emergency management cycle, and in many cases worldwide. And there are activities happening around this cycle at all times, especially for those who are actually in the emergency management business. I can tell you that me and the big team we have at APD are working in this cycle year round to make sure that we're prepared for the emergencies that could befall Florida and could affect the Agency for Persons with Disabilities and those our clients and those who care for our clients, which is you. So I'll be talking about each one of these phases a little bit as we get through this slide presentation, but I just wanted to let you know that it provides us with a common language and understanding about what is occurring when and why. And I'll give you an example of common language. As we all know, in California, we've seen horrendous wildfires. And whether we're talking about those wildfires or a catastrophic hurricane in Florida, you know, many teams who are trained from outside of our states come in to help us. And if we didn't have a common language that we used or an understanding of this cycle, we wouldn't be able to get through it as efficiently or effectively as we possibly could. So I'll be talking about this cycle as we go through our session today, but I wanted you to see what it looks like. Next slide. So we're going to start with the quadrant in that cycle called preparedness. And I know that a lot of what I'm talking about, you've heard it before as we approach June 1st, which is the beginning of hurricane season. You hear it again and again. But what I'm going to try to do is help make it real to you. And it probably is. I mean, if you've done your own personal or family disaster planning, you are going to be so much better able to assist your clients or consumers with theirs. And you know that you're called upon to do that. So that's why your own personal preparedness is also really important, because if you're worried about your home or your family, it's very, very difficult to worry about others that you have the responsibility to care about and care for. So I can tell you the return on investment of time spent planning will pay off exponentially during an emergency, and that starts with each one of us. And so I'm speaking for myself as well as all of us when we talk about the importance of preparedness. I know that Susie's going to be sending you these slides, so a lot of these links, whether they're planning resources, etc., you will have them, so you'll have them at your disposal to be able to utilize them. But you know, it always starts with an emergency disaster plan, and just because you did one 5 years ago doesn't mean it's current today. A lot of things change. Again, you know, just that little bit of time invested in planning will help you and your family, and it'll help those that you care for. Next slide. And if you're wondering, well, where do I start? Because, you know, a lot of times we'll put a plan together and we forget the most basic things. So look at these questions. These are the 4 questions you can start with for you, for your family, and for your client or consumers. How are they going to receive emergency alerts? In a subsequent slide, I'm going to show you a link to an example of an alert, but are they looking at their county? Are you looking at your county emergency management site? Do you have the app, you know, your county app that gives you weather warnings or alerts? They're free, the apps are free, and you can utilize those, and you can be alerted when something's going to happen. What is your shelter plan? Are you going to stay in place? Are you inland? Are you, how about your clients? Are they planning to go to a hotel? Are they planning to go to their aunts in Alabama? What's their plan? I mean, you know, we don't encourage people to go to shelters if they don't have to. It's not the greatest place. It is a safe place, but surely if you're in a group home, going to another group home with like services, or if you go and visit relatives out of harm's way, those are always better options. But what is the plan? What is your primary, secondary, tertiary? What are the kind of places you could go to, and how are you going to get there? Do you have transportation? What is your evacuation route? Do you know what your evacuation route is? All across Florida, we see signs with evacuation routes on them. And do you really know how to leave your home and get to where you're going? What is your communication plan? And why I say that is often in a major emergency, we'll see communication lines down. Sometimes texting is much more dependable than picking up the phone and calling. But there are going to be times where texting isn't even going to be available. So a good suggestion for a family communication plan is to call an out-of-state or an out-of-hazard area friend or relative where you, your family, your loved ones can call them and just let them know that you're safe and well. And if everybody calls that contact, to say, you know what, this is where I am, I'm okay. It will give so many people peace of mind. And so that's just part of your personal disaster plan, or the disaster plan that you work with your clients on. Make sure that your plans and their plans, they meet their specific daily living needs and responsibilities. That you know more than most, actually, how important that is. If someone depends on certain providers and supports for life-sustaining work, we need to make sure that in their personal disaster plan that they have thought that through and to know exactly what it is they need. And every one of our own personal plans, every one of us has a plan that's unique to us, and that is the same for you. It's the same for your family. It's the same for the clients that you serve. Their plan needs to be unique to them, and it can't be the same plan every year because, as you know very, very well, their needs change over time. So, and then create their own network, all the phone numbers that they need, put it on the refrigerator. Know where they really need assistance. Not nice to have when we're talking about a major emergency, but need to have. And so that resource directory that you'll see on that, we put a resource directory together every year. So you'll have this link as well when Susie sends you these slides. And then there's disaster supply kit lists all over the place. Look and see what you've got in your cupboard, or look and see what your clients have. Is it food that's expired? Is it water that needs to be replenished? And then know what community resources there are. There are 67 counties in Florida, and there's 67 different levels of resources that can be brought to bear. Next slide. You're going to get these slides again, so I'm not going to read over each one of these, but these are great lists. I've got 2 slides of these lists of the kinds of things that you might want to look at and make sure that you have it for yourself and that your client has what it is that they need too. So this is a pretty good substantial list, and then you've got a link to this that's a kind of a disaster supply checklist that you can utilize as well. Next slide. And then, of course, at the end of this particular slide, you also see pet service and animal care. I mean, they're part of the family, and it's really important that we prepare our pets and service animals as well as for our families and for ourselves. So all of these things are very important, and I think that when you look at it, make sure you've got what you need. And then you can even be better at helping those that you serve to be prepared with what it is that they need. Next slide. You know how I was talking about emergency alerts and apps? Here's just some examples. On the left-hand side are some of the Red Cross apps. There's a Red Cross First Aid app, which is free, and I think that might be very helpful. And then there's also an emergency app, which talks about weather alerts, where Red Cross shelters are, etc. Not all shelters are Red Cross operated shelters, but every county emergency management office will have a list of the shelters that are open. We have 2 types of shelters in Florida that government manages. One is a general population shelter, and the other is a special needs shelter. And I'm going to talk about both of those in just a moment. And those emergency apps, the Red Cross one anyway, is in English and Spanish. And then the Alert Florida app. This is a great statewide notification initiative. So there's the link to that. Again, you'll get the slide, so you'll be able to have it. Next slide. So in that emergency management cycle, preparedness was in the upper left, response is in the upper right. And this is what happens during response. You've lived it. If you've lived in Florida for just even a short period of time, you have lived some semblance of response. And this is when life safety actions and decision making occurs. All disasters start and end at the local level. That second bullet, the state emergency response team, and this is important for you to know. Me as an ECO and all the state agencies, sometimes the federal agencies, are all together at the State Emergency Operations Center, and we make up the State Emergency Response Team. And why I believe it's so important is that that's why no one should be falling through the cracks. It's a team that stands ready to support the local governments and local local evacuations, local sheltering, and local recovery. And that, that stays with us. It stays operational throughout the lifetime of any disaster response. And again, in response, that's where you see the first responders, fire, police, ambulances, etc. Know that at a certain point, when winds get above sometimes 35, 40, 45 miles per hour, we have to put those emergency vehicles off to the side because it's not safe for them to operate. And that's why if you hear the words of local officials telling you to evacuate or even stay home, depending on what it is that they say, it's so important to follow, because the earlier we can follow their guidance, the safer we will be. In response, that's when you see evacuation and sheltering happening when it needs to. That's when you might start to see power outages. That's might be where you start seeing people going to healthcare facilities. That's what surge means. And that's where you start to see some infrastructure challenges. But all those things are happening in response, and they're being responded to at that point. Next slide. So as Susie said, I'm going to talk a little bit about local, state, and federal government responses. Again, all disasters are local. The first assistance is going to come from local responders. The state's role is to assist local governments with, it could be response, it could be communication, it could be sending in power trucks to reestablish power. Again, we're at the State Emergency Response Center, Operations Center as a member of the State Emergency Response Team. And then federal government, we don't always see federal government, but if the governor requests that we have a presidential declaration and the size and scope and damage are such that they believe the federal assistance is needed, which we have seen in the last 2 years. The last 2 hurricane seasons, as you know, FEMA has been in force to support the state and the locals. One thing I want to say about that level of assistance, federal assistance, it's not always the same assistance. It depends upon the size, the scope, the amount of damage, etc. So if you've seen one disaster, you've seen one disaster. They're not all alike, as you know, because you've all lived through it. And so we cannot expect that all of the resources are brought to bear after every disaster. And why is that important for you to know, for you personally, for your family, and for your clients or consumers, is because it's important to pay attention to what resources become available after an event, so that your clients or you even can avail yourself of those resources. One of the things we try very hard to do at APD is to make sure that our website contains the kind of information that you need about what resources are available and how to get them. It could be an 800 number where you call FEMA and apply over the phone. It could be you can, your computer's working and you can apply online. It could be, and you saw this in both 23 and 24 those fall storms, where there were MARCS, the Multi-Agency Resource Center, which is a state level resource center, or the DRCs, a Disaster Recovery Center, which is a federal site. You could go there and speak with FEMA about your FEMA application or to make an application. And I know that's not as easy for some of our clients. And so we have to work along with them to help them apply for and receive services if it's going to help them recover from a disaster-caused occurrence. Next slide. And then on the bottom right quadrant of the emergency management cycle is recovery. And I will tell you, for the 24 storms and even for Hurricane Ian in 2023, et cetera, we are still working in recovery. There are still people, there are thousands of people in hotels still after the fall 2024 storms. So there's a lot of us still working in recovery. Not many APD clients at this point that I know of. If I knew about it and if I knew there was unmet needs, I would work with you and work with them on it. But there's still a lot of folks who were greatly affected by those storms who are still in recovery. They're waiting for building permits for their home to get rebuilt. There's so many different things that are occurring. But early recovery, you're going to see, that's where you see like points of distribution. Say the grocery stores and markets are down and people need water, or they need ice, or they need meals ready to eat, or MREs. You might see each county opening up points of distribution where people can drive up and receive product that they can't get any other way. You'll start to see those pods, they're called pods, you'll see them close as soon as the markets start opening up. Because we want to rebuild the local economy. But those pods will be set up in a major event. You'll start to see debris collection. And debris was a horrendous problem this past fall. And if any of you on this call live in Pinellas County especially, or Hillsborough County, you know that debris was a huge, and remains a big problem, because there was just so much of it. And in areas like that, it's going to take them a lot longer to recover. But it's not because people aren't trying to work together. It's amazing the work that people have been able to do and continue to do. You'll see in recovery, individual assistance program. That's what IA stands for, both state and federal. And that's what I was talking about before. No two disasters are exactly alike. Different resources become available for different disasters. It's important that you ask questions like, what is available? This is what my clients need. And you should communicate that with your regions. Coordinated, you're going to see a lot of coordination, county, state, and federal resources. If you recall, I was talking about the common language. That's clearly evident as you see that kind of coordinated action. I already talked about the state level, the MARCs, multi-agency resource centers, and the DRCs, disaster recovery centers. And then you'll see now we have unmet needs and long-term recovery committees. Those counties that were hardest hit have pulled together private, public, faith-based groups that become members of these long-term recovery committees, so that people can really continue to recover and become part of their own recovery. Next slide. And then mitigation, I mean, that has to do with community disaster education. It has to do with knowing if you're in a flood zone. It has to do with making informed decisions on where you live and your type of home, like knowing your zone. Do you live in an evacuation zone? Does your client live in an evacuation zone? Do they have to leave? If they don't have to leave and they're safe in their home, sometimes that's the best place for them, is to stay home. And then to know your home. Is it secure? Does it withstand wind and water? How safe is it? And that link below at the bottom of this slide, that is an extraordinarily important link. It will help you. You can go to that link. You'll look at a Florida map. You can hone in on your county, your city, where you live. It will tell you if you're in an evacuation zone. And that's really, really helpful. So it's very user-friendly and very personal to you, your family, and your clients. And that's also in mitigation. That's where you see community rebuilding and resiliency. Next slide. So some of the expectations of you, and you've got a big job, no question about it, and a very important one. during disasters. And what we've been talking about a lot already today is how important it is that you stay personally prepared. We want you to be safe. We want you to be personally prepared. Ensure that your clients' disaster plans are updated annually. And a good time to review it is at the start of every hurricane season. And you know, just that conversation you have with them, sometimes it's reminding them of what's in their plan, or maybe tweaking it. Perhaps some of their key individuals that they count on. It might be their doctor, it might be some providers, maybe they've changed, maybe their phone numbers have changed. There might be changes. So have that conversation. Take the time to really talk through their personal plan. Communicate with them before, during, and after an emergency event. We really do expect that you will report back to your regional office using established systems of reporting to let them know if you're concerned about clients before, if you can communicate with them during or after an emergency event, how they are. Do they have power? If they don't have power and they need power, what are we going to do? You know, disasters are really a series of conversations, and it's a lot of problem solving. And there's no one way to do things best, right, all the time in a disaster event. So sometimes it's just talking things through and trying to decide what's the best avenue of recourse. What do we need to do about fill in the blank, whatever the situation might be? Oh, this is an example of something. Someone's got a tree fell on their roof. They would really like to stay home, but they got to get this tree off their roof, and there might be a hole in it. Well, working with the faith-based community to put a tarp over it, you know, they can come and they can remove a tree in many areas and put a tarp over it so that no more water gets into that house. There's so much that can be done. Again, nobody should fall through a crack if we can help it. And we are, again, in this together to help them through, to help you through. Make sure their records are up to date in iConnect. And this is so very important. Please, please make sure their living setting, their physical address, and their phone number is up to date in iConnect. You know, I'll talk about it in a minute, but we utilize the Everbridge emergency notification system, and your counties use that same system to send messages to people. It might be a phone call, it might be a text, it might be an email. And so you get the same message 3 times. I'd rather you get it 3 times than not get it at all. But if your information or their information is not correct in iConnect, we're not going to be able to get through to them with information that could be very important for them. And then again, report any health and safety concerns and updates to your region utilizing your established process. Next slide. Communication is key throughout the entire disaster cycle. Emergency management cycle, communication is key. Call them, text them, email, whatever works. We want to make sure people are safe. Make sure that they know if they should evacuate. And of course, that's part of planning. And if so, where they're going and how they'll get there. I know I'm being redundant, but it's that important. If possible, do a home visit. And that's where curfew letters may apply, and you'll go through your region for that. Make sure that the support services are available to assist them after the disaster. Ask them about damage to their home. Is their home habitable? We do not want our clients or you living in a home that is not habitable. And if not, we need to work together to get them assistance, get you assistance, and ensure they can recover. And some of the recovery takes a long time. And sometimes it won't take such a long time if we're smart about it in early stages of recovery. Next slide. All right, a little bit about sheltering. This is, you remember I said there's 2 kinds of shelters in Florida. There's general population shelters and there are special needs shelters. A general population shelter, every county has to have shelters. They know that if they're going to be called a general population shelter, that they're not in an evacuation zone and they can withstand wind and water, and that they are a safe building. But it truly is just a life raft. They do need to be accessible. Generally, you might get 10 to 20 square feet, and there's not medical care in a general population shelter. And I just put some stats down there. If you look in the fall of 2024, we saw 22 shelters with 352 people for Hurricane Debby, 99 shelters and 8,450 people in Hurricane Helene, and then 282 shelters with 83,000 and plus people in Hurricane Milton. So that just gives you an idea of scope. Comparatively, in the fall of 23, Hurricane Ian saw 256 shelters with 33,000 plus people. Next slide. Special needs shelters. This should also not be the first option. I mean, really, first of all, the registration for special needs shelter, the special needs registry, you have to register annually. You can go on your county emergency management website to register, and there's also a link there, and that's the health department registry. It's the state health department registry. They go to the same place because emergency management and the Department of Health work together on this special needs registry. So you have to register. Your clients need to register annually if it is one of their options, and registering doesn't ensure a spot. For the number one reason that every county has different levels of capability. They really look for those who are medically fragile, electrically dependent, and oxygen dependent. They're not ill enough to go to a hospital, but their medical condition is such that they really would not do well in a general population shelter. There is generator power, and usually the refrigerators will run refrigerators for medications. They might get 40 to 60 square feet per person. Caregivers are most often necessary. And then as an example, in the fall, we saw 18 special needs shelters open in Debby with 100 people, 41 for Helene with 872 people, and 63 in Milton with 4,300 individuals sheltered. Depending on how long either the general population or special needs shelters are open, it depends on where people can go. And so there were teams sent into many of these shelters from the CERT. Remember, I was talking about the State Emergency Response Team, to see how people were doing and where they were going to go. We surely cannot send people home from a shelter if their home has no power, it's not habitable, etc. So we saw programs arise like the hoteling program, or the trailers that you might have seen. So depending upon what the needs are after a disaster, again, will depend on the kind of resources that are brought to bear. And that's why paying attention to what we put on our website, what your county is saying, etc., is so important. But no question should remain unanswered in the midst of an emergency. Please feel comfortable asking your questions to your region. I'm communicating with the regions all the time, and not just me, but our team. So it's important we don't let anyone fall through the cracks. Next slide. Alternatives, shelter in place when you don't have to leave. Again, this is that same link, know your zone, know your home. Shelter in with friends and family is a good idea if possible. Group homes, the use of host home approach worked really, really well. And we had over 100 group homes that had to evacuate in last fall, especially during Milton. But why that works so well, it combines resources and expertise, and there's a better environment, and there's service flexibility. Hotels and motels out of the affected area can work, but it's important people evacuate tens of miles, not hundreds of miles, unless hundreds of miles means you can leave for a long time and you've got family outside of the affected area. And for our clients, why you really don't want to go hundreds of miles, perhaps, is dependent upon what kind of provider resources that they need for their own health and safety. Next slide. APD, It's important for you to know. I just want you to know that we have plans in place. They're plans that we look at all the time, that we update all the time, just like a personal disaster plan needs to be updated. Our comprehensive emergency management plan and our continuity of operations plan are updated all the time. And then we communicate essential information to you, to consumers, to providers, to our WSCs and our staff. And we have a toolkit that we will be making sure stays up to date for each event so that you know what resources are available. I talked about it before, but we do utilize the Everbridge emergency notification system to send you messages when there is an emergency. It also manages flexibilities. If we need to look at reporting timeframes because of the nature of the emergency, we might have to work with ACA or DCF to see if we can be flexible with some things, but we need to hear from you about some of that. And we problem solve together throughout the cycle. Next slide. These are just some resources that you can, I'm not going to go through each thing, but we'll send you resources about the power outage or Florida 511 to know what roads are closed, or where there might be floodwaters that pose health risks. So there's boil water notices. All these things are so important, school closures, all of that. And then there you can even register for FEMA. We'll provide you with those 800 numbers, or where at the time, if there's a MARC or a DRC that opens up, we'll provide that to you. Next slide. All right. Information is key. We can't make a good sound, none of us can make a good decision without good information. So gather that information as much as you can. We'll problem solve together. You'll problem solve with your clients. You'll problem solve with your regions. But ground assessments, don't take the first thing you hear. And make sure before we start working on something that it's true, that it's grounded, because in the midst of a disaster, when there's a lot of energy and a lot going on, it's easy to make a statement that isn't grounded, and we don't have that kind of time. So we do need to ground assessments, and then communicate essential information to your clients and their families and your regional offices, and just stay aware. I mean, we all need to stay aware after an event. Well, before, during, and after an event. Next slide. Planning, again, a plan's a living document. We've already talked about it. We all need one. Be sure that, especially for your clients, if they task somebody with a role in their plan, make sure that that somebody knows that that's what the expectation is. If, for example, if they think their neighbor is going to drive them to a hotel, make sure the neighbor knows and the neighbor's okay to do that. And then, those are the things, then it lists the things that would be in a client's disaster plan, how to meet their communication needs, what their evacuation and shelter plans are, what their transportation, what essential services they need. And that includes medications. Update and practice it annually. Again, the return on the investment is great in that regard. And I think the most important thing, you can go to the next slide, Susie. It's, if you've got questions, whether it's today or in the future, put them in the chat and we'll go through them. And then if you've got questions later, reach out to me or reach out to your regional office. We've all got a lot of experience, good and bad, experiences, emergencies and disasters together, but we are in it together. We're going to get through it together. So I really appreciate the opportunity to have this conversation with you. So Susie, I'll turn it over to you. Thank you.
All right, let's see. I'm trying to. I think there, at the moment, I'm only seeing one. Is there a place where our families could get disaster kit supplies donated?
A lot of times, that's a good question though. A lot of times I would pay attention to your county, things going on in your county. It might be with faith-based groups. That's going to be a county or even a municipality gift for disaster supplies. I know that I see, you know, I'm in Tallahassee. I see often different churches and different groups who will put supply kits together for different groups, but you'll have to pay attention to where you live about that. There isn't a statewide entity, although, and as soon as session's over, we'll have the dates. There will be 2 of those tax-free holidays to purchase disaster supplies again this year. I don't have the dates yet. We're waiting for a legislative session to get over with, to get those dates. As soon as we get those dates, we'll make sure we put it on our website. And that's one help for you.
All right. The next question just came in. It says, under the mitigation slide, how often are those zones updated? With every major storm?
Actually, they stay updated. You're talking about the know your zone, know your home, know your zone, know your zone, know your home, excuse me. It stays updated. And if it's not, if you go on that and you don't find that it's updated, you know, let county emergency management know, but they really do keep that updated because remember the disaster cycle, they're working that cycle year round. So they're updating those links all the time. And if it's not, let them know. But I'm pretty sure it's updated all the time, not just after each event.
All right. Can APD assist in buying generators?
I don't believe that a generator is an approved purchase. I'll get an answer for you. I don't think so, but I don't want to just answer that question with a definitive no, but I'm kind of pretty sure it is, but I'll find out for you.
Let's see. Is there anything in the works to get WSC's help with food supplies during a disaster for their clients? Most food banks are not able to help them during this time.
That's a great question. Thank you for whoever posed that question. Remember I talked about the pods, the points of distribution, and the MARCs, the Multi-Agency Resource Center. Very often in both of those locations, you will find food. Now it's going to be probably perishable food, and you'll find a lot of food drives after an event. It's real important to stay to monitor local resources, but those pods will have, you know, often food, water, ice. The other thing I do want to say, if your clients live in an area where there's a lot of people in that area that need feeding, the mass care, which includes feeding, sheltering, bulk distribution in Florida, is very, very robust. There are a multitude of partners that are here in Florida or come into Florida, i.e. the Salvation Army, the Red Cross, the Baptists, Operation Barbecue Relief. I can go on and on with the feeding resources that early on especially provide hot meals, and they do it through mobile feeding and in some cases fixed feeding sites where we can get the food and bring it to people. So it's very robust. And last year even, they had a map where you could go on the map, and I think we put it even on our website, and you could go to all of the different affected areas in Florida and click on those areas, and you would see where the bulk feeding sites were or mobile feeding routes were, and there was also a map of where the pods, the points of distribution were, and then we also listed the MARCs. So there's the plentiful resources in mass care and in mass feeding after a major disaster event. So pay attention to the website. And if you like in the midst of a disaster and you know of clients who need feeding or food, let us know, because we meet every single day with all of those feeding resources, me included. We meet every single day to find out where food is available. So again, nobody should be hungry after an event in Florida.
Okay, and I believe somebody asked if they could get that website. It's part of the,
Well, that's down now because there's not feeding resources now. That was after like each of those hurt, like in 2024, the fall of 24, there was a map put up for the feeding resources after Debbie, then after Helene, then after Milton. But those emergency resources are not there now because that level of emergency, that response is over with. And the grocery stores and markets are open.
okay. Will there be alternative resources for FEMA once they are eliminated?
Well, you know, I cannot answer that question. I have no idea what, I can't even speak to that.
That'll be one we will weather that storm together.
Not surprised you asked, but I cannot speak to that for sure.
Do APD licensed group homes receive any assistance from APD to purchase generators for their homes, and are generators required now?
Generators by law are still not required. We were not part of that rule back, gosh, it was about, I'd say 8 years ago, 6 years ago. So it's not required. Of course, it's always encouraged. And that gets back to the question, can APD buy generators? And I'm pretty sure the answer is no. So I will get a definitive answer for you on that.
Okay, and the last one for today, at least for the webinar, if you have more, please send them to the regions or Karen or, but for the last one right now, can we share this with providers to assist with them filling out their disaster plans that are required to submit?
Could you say that again, Susie? And could you also move to the last slide, because my contact information is on the last slide?
Certainly, one moment.
Read that question to me one more time because I didn't get it.
Okay. It says, can we share this with providers to assist with them filling out their disaster plans that are required to submit? So I'm guessing they're wanting to share this information, the presentation with them is my guess.
Absolutely, you can. But you know that for group homes and for ADTs, there are specific requirements of how to fill out their comprehensive emergency management plans. But all the resources on this slide, please share. Absolutely.
All right. And if you guys did put in any other questions in the chat that we did not get to, I will make sure to download them and send them to Karen. And we will get answers to you as soon as possible. Any further things that you would like to address, Karen?
No, I just thank everybody for their time. I really do. I can't tell you how important your investment of time today means to both you and the people you love and those that you care for. So thank you, thank you. I'm really glad to have spent this time with you.
And we really appreciate you doing this for us, Karen.
You are welcome.
All right. Thank you, everybody. And I hope you guys have a great day.